Hello everyone, it's me Dr. Ayaz Ahmed. I am working as a aesthetic dermatologist. Today I will discuss another important topic of dermatology. The name of topic is anti-phospholipid syndrome. Hopefully you will learn and subscribe my YouTube channel. Definition: anti-phospholipid syndrome, or abbreviated as APLS, is an autoimmune disease with thrombosis and pregnancy related complications. For example, fetal loss, preterm delivery, and placental insufficiency. Thrombosis usually involve veins, arteries, and microvasculature system. Antibodies are directed against cellular phospholipid component, most commonly lupus anticoagulant, anti-cardiolipin, and anti-B2 glycoprotein. Introduction and general description. It is also known as APS syndrome, HUX, or familial lupus anticoagulant syndrome. Primary APLS usually occur without any disease, while secondary APLS occur in context of other autoimmune disease, for example, systemic lupus erythematosus. Epidemiology, prevalence, incidence, age, sex, ethnicity, and associated disease. The prevalence of this disease is unclear. It has been observed that 1 out of 5 had stroke at less than 50 years of age. Moreover, 40% have SLE with anti-phospholipid antibody, but less than 40% have thrombotic event. 1 out of 4 patients of thrombophilia disease have been noticed this APLS syndrome, and 1 out of 10 women having miscarriage exhibits anti-APLS antibody in the blood. It is common in young to middle age group and in women. It is found in Hispanic, Asian, Afro-Caribbean, and Native American. Associated disease. Secondary APLS are associated with systemic lupus erythematosus, Sjogren's syndrome, arthritis, systemic sclerosis, syphilis, and hepatitis C infection. Pathophysiology. The pathophysiological features of this disease are increased expression of a tissue factor on monocytes and endothelial cells, interference with protein C anticoagulation pathway, inhibitions of fibrinolysis, inhibitions of annexin 5 binding to phospholipid, and finally B2GP1 cofactor requirements for antiphospholipid antibody to bind to cardiolipin. Clinical features. The clinical features of APLS syndrome include thrombosis of vessels, most commonly deep vein thrombosis of lower limb or pulmonary embolism. Arterial thrombosis most commonly affects cerebral artery, leading to ischemic stroke. Unexplained death of a normal fetus, miscarriages, these are the clinical features. While the clinical features related to skin are thrombophlebitis, purpura, ecchymosis, livedo, rectangularis, leg ulcers, cutaneous necrosis, gangrene, and subungual splinter hemorrhage. Differential diagnosis. The differential diagnoses are condition of thrombocytopenia, heparin-induced thrombocytopenia, and thrombotic thrombocytopenia purpura, and disseminated intravascular coagulation. Now complications. The complications include thrombosis and pregnancy morbidity, thrombocytopenia, occlude valvular head disease, chorea and cognitive impairment, hemolytic anemia and nephropathy, transverse myelopathy in SLE. This transverse myelopathy in SLE is especially associated with APLS syndrome. Investigation. Testing for lupus anticoagulant and testing for IgG and IgM antibody to cardiolipin. B2GP1 cofactor testing via ELISA are required. Always note that the positive test should be repeated after 12 weeks. Lupus anticoagulant have prolonged apatity that does not correct in 80:20 mixture. Another important tests are DRVVT, KCT, TDT, and DTT or prothrombin time are the main test. Treatment ladder. The treatment ladder are number first is the first line. The first line treatment ladder includes anticoagulation therapy, which includes heparin and warfarin in non-pregnant women. Heparin plus or minus low dose aspirin to be considered in pregnant women. Second line treatment options are oral direct thrombin and anti-factor 10 inhibitors, combinations of anti-aggregant therapy which includes low dose of aspirin plus clopidogrel or dipyridamole and low dose of aspirin combined with hydroxyquinone in those with SLE. These are the second line treatment options. While third line treatment options are immunomodulatory therapy, which includes plasmapheresis, intravenous human immunoglobulin, and rituximab. In refractory cases, plasmapheresis is indicated. Thank you very much. Stay connected and subscribe my YouTube channel.